Hello and welcome. My name is Calliope and I'm going to be performing your procedure today. Would you mind just confirming your name and date of birth for me? Excellent. Alright, let me see here. Are you in any current pain or have any current illness at all? Okay, so you're having some issues with your left ear, right? Okay. Can you tell me a little bit about that? Just going to be taking some notes here as you speak. Okay. Alright, so some irritation and some issues with hearing. Okay, and nothing going on the right side, correct? Okay. Okay, so have you had any changes to your medical history since we last saw you? Okay, and your family history? Good to hear. And any new allergies, changes to allergies? Okay, and what about your medication list? Okay, excellent. Alright, so looks like we should take a look at those ears, huh? More specifically, your left. So let me see here. Just going to set that down. I'm going to pop on a pair of gloves real quick, okay? Alright, so to take a look at your ear, I am going to need to touch you for that part of the examination. Is that okay with you? Do I have your permission to do that? Okay, wonderful. So I'm going to pop on these gloves real quick. There we are. And now I'm going to take a look at your left ear. I'm just going to get in real close here, and I'm just going to inspect the outside of it firstly. So, preauricular area, pull your ear back and look at the post-auricular area. The external structures of the ear itself look to be normal without any swelling or irritation. Okay. Very good. I am going to grab my otoscope real quick and we will have a look inside the ear itself. So I'm just going to be taking this sterile speculum and my otoscope here. Okay, gave me a little more trouble than I usually bargain for. Okay, we have our light. So I'm going to be putting the otoscope inside of your ear. I'm going to take a look at the ear canal itself. I'm going to look at the tympanic membrane. Just going to see if there's anything going on, any irritation, any swelling, perforation of the eardrum, as well as any other possible problems, okay? Okay, so I'm going to come over to your side. Alright, let's take a look here. So, I'm just going to pull up and back on the earlobe, and I'm going to be just inserting the otoscope into the ear canal, rather. And we're going to take a look here. So I see quite a bit of a buildup of cerumen here, and it is a little red, a little rough, a little irritated. So that might be our issue right there. I'm gonna see if I can look at the tympanic membrane itself. Okay, there we go. We've got the pearly gray color. I can see the cone of light, tip of the malleus. Excellent. Okay. Okay, so alright, I'm just gonna take just another little look around. Okay. Alright, pull that out. Okay. So I think what we have going on here is a little bit of a cerumen buildup. So, a cerumen is the medical term for earwax. And earwax, of course, is a natural substance, natural lubricant that is excreted by your ears. And normally it is a wonderful substance that lubricates your eardrums, catches little bits, keeps them from going into the ear, so on and so forth. But when there's a blockage, then we get some irritation, some itching, some redness, and there can be a possible detriment to hearing. And if it gets severe enough, then we need to manually extract it before it becomes a real problem. Okay? So, today I am going to give you just a little bit of a cleanup, and then I will remove that cerumen, and that should really help your situation. We'll do a little hearing test after I've cleaned you all up, just to make sure that that was the culprit, and then we'll send you on your way. Okay? Do you have any questions so far? Okay, very good. So, let's get you cleaned up. So, firstly, I'm just going to take this kabuki brush here. And this kabuki brush, I'm just going to use to dust off the ear and just dust off any loose dirt or debris that's naturally accumulated throughout the day. And after that, we will wipe your ear off with an alcohol solution, and then we can begin. Okay? Alright, so I'm just going to come over here, and I'm just going to just gently brush over the ear. Brush behind the ear. Brush in front of the ear. So, there are many different ways that our cerumen can become impacted. One of them is the modern miracle that is cotton buds or Q-tips. And people like to stick these inside of the ear canal, which even on the box itself it says do not do that. But some people cannot resist the urge, and what you're doing is you're shoving that cerumen deeper and creating an impaction. And some people just naturally produce a lot of cerumen. It's not a big deal. It happens to tons of people. But those people just need to make sure that they are getting their ears cleaned regularly. that there isn't an issue later on. Okay. Alright, that looks good. So we're going to use some tissue and some alcohol solution. Just going to clean the outside of the ears. The ear, rather, the right ear. That looks good. All ready to go? Okay. So, in this little glass bottle, I have this dropper with a little translucent substance. And I'm going to put a few drops of this particular solution inside the ear. And this is going to clean out your ears, okay? So we'll have it in your ear for a little bit, and then I'll have you tip your head over to let it drain out, okay? So if you could just tip your head to the side for me. I'm just gonna come over here. We're just going to place the dropper in the ear and just drop, 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 drop. Okay. Might take a moment, but then you're gonna feel your ear kind of a odd sound to it a little bit while the mixture is working inside your ear. And after a little bit, then I will grab a little tissue and we will tip you over and we will clean you up, okay? Okay. Feeling okay? Doing okay? Okay, glad to hear it. I'm going to grab a tissue here, and I'm going to have you gently come back over. I'm just going to place this just over. Just have you wait there for a few moments while all the liquid falls out of the ear, okay? Alright, very good. Looks great. So, I'm going to put that down. And I want to take just another look in your ear to make sure that we got everything, okay? So, let's see. I'm just going to pull up and back on the bit of there and insert the otoscope. Okay, we are looking much, 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 much better. Very good. Okay, there's just a little bit of cerumen left, which is good. We don't want to get rid of everything. It's there for a reason. Okay, excellent. Right. how's your hearing feeling? Okay. Do you think it maybe has improved a little bit? Okay. I am going to whisper some numbers into your ear. I just want you to repeat those back to me, okay? Okay. 6, 13, 54. Okay. Did you hear those okay? Alright. Excellent. So I'm going to get another tissue, some more alcohol solution, and we can get you cleaned up a bit, okay? Okay, let's have a little look. Looks good. Alright. Is there anything else I can help you with then today? Okay. Excellent. Thank you so much for coming to visit us. If you have any other issues or, well, any problems at all, please call our office. Let us know. We can help you out as soon as we can. So, thanks for coming in. I hope you have a whale of a day, and I hope you have a good night. Thank you. Goodbye now. Thank you so much for watching. I really hope you enjoyed this video. Please like this video if you want to, comment if you'd like to, subscribe if you want to see more from me, and if you want to catch me on some socials, my Twitter is at Calliope Whisper with no S. My Instagram is at XX_Calliope. I'd like to give you a special thank you to my patrons on Patreon, for whom this wouldn't be possible, as well as the support